Does your trust face the daily challenge of bed capacity management? Are your clinicians spending hours every day on phone calls, meetings, and spreadsheets? Are you paying for private beds to create more capacity that could be created by having a more efficient patient flow? Access Patient Flow Manager can help. Let's look at a typical situation in a trust. Post-COVID, demand for beds has increased. This has meant that a lot of community and mental health trusts have had to pay for additional private beds to cope. These come with huge costs, on average £680 per bed per day. With just 60 private beds, that's £15 million every year. The status of patients is also harder to monitor, with clinicians having to call the private providers regularly for updates. Due to increased demand, there are more patients on the list for a bed, typically waiting in acute beds, A&E, or being looked after by crisis teams in the community. Not only does this reduce acute capacity, but it also increases risks for patients who are in the wrong place for their care. Typically, the capacity of each ward in a trust is kept in spreadsheets and on physical whiteboards that are updated 3 times a day. This information is provided through meetings, normally including 6 clinicians for 2 hours every day. That's using 84 hours of clinical time every week. Not only is this inefficient for clinicians, the use of spreadsheets creates clinical risk due to information going out of date and not being in a central location. Reporting issues. Many trusts use upward of 10 people to create reports of bed capacity. Lack of visibility to see where patients are and where there is capacity to take patients that are waiting. With Access Patient Flow Manager, these problems can be solved and patient flow can be improved to allow more capacity for those in need. Using simple dashboards, Access Patient Flow Manager shows an overview of who is on each ward, with bed cards showing patient information including allergies, where they have been referred, and what care is required. Clinicians update the dashboards directly, so all information is updated in real time. Syncs to the EPR and PAS systems. No need for 3 meetings every day just to talk about capacity. And handovers are easy because all information is up to date and at your fingertips. This also removes the clinical risk of spreadsheets as information is safely stored with role-based access. Information from private providers can be added straight into the system, giving an overview of care provided outside of trust beds, removing admin time and duplication of effort. Wards can also be configured to support those in virtual wards, keeping track of their care. All this information flows straight into the EPR, so any care provided can be seen by relevant healthcare professionals. Reporting is easy, giving visibility of capacity and care provided both at ward level and across all wards in the trust. Clinicians are able to use Access Patient Flow Manager to complete and track referrals without needing to make multiple phone calls to services. Wards can also be configured to show individuals that are on leave and show for how long, so their bed can be temporarily reallocated. The system also alerts clinicians when a patient has not returned from leave to ensure they can be found quickly and safely. When a patient is ready to be discharged, they can be moved to the discharge lounge within the solution, freeing up their bed within the system to be reallocated. Access Patient Flow Manager frees up clinical time to focus on providing care, reduces meetings and minimises phone calls, improves clinical safety as information is updated in real time and securely stored, gives full visibility of where patients are and where there is capacity on wards, helps to reduce the length of stay and delayed transfers of care, makes reporting easy both for ward managers and at the trust level. Referrals and assessments can be tracked so any delays can be easily seen, improves patient flow, improving capacity and reducing the need for private beds. And most importantly, improves patient outcomes as the right person is in the right bed at the right time. Get in touch to find out more.